And the crowd falls deathly silent. Okay, so we have a 100-question written test not next week, the week after next week, right? Yeah. So those that don't test today, oh my gosh, it's a clean board. What happened to everything? Everything got wiped out. Oh, there it is. Okay.
You told me to wipe it off.
Yeah, that sounds good. Thank you. No, I didn't mean the whole board, but that hasn't looked that good since the beginning of the semester. So, thank you. So those that don't test this week, we will test you next week. And also the week after that, we'll have the written test. Okay. Week after that, we'll start another chapter with all the facial bones and all that, sinuses, all that, just like we did the other time. Everybody will show up again like this for that one. All right, questions? Yes?
Where are we having our test at?
I'm probably here. I think I'll do this usual, we'll put like 4 back there, a couple, 3, 4 over here, and then you skip a seat in here, and then a couple or 4 in each room, that type of thing.
Okay.
Spread you out. Yeah, we're just going to spread you. Oh yeah, it's just your regular 50 aside. So it's 100 questions. 100 questions. 41 of the questions are diagrams. 41 are almost half the test is diagrams. Now, you just can't mess up on diagrams, people. It's just like wow. I give you all the answers. Process of elimination. That don't pick prunes. Don't pick prunes. Don't pick the wrong answer. So, matter of fact, let's go over that here real quick. So, the first diagram is going to be that the cella turcica. It's in your book. It's in your book. Looks something like this here. See that? See that? Looks like that. Okay. All right. Then we got the floor of the cranium. Floor of the cranium. That's your diagram. Looks something like that right there. See that? All right. And the other one is just the skull with your bones that make up the skull plate itself. It looks something like that there. See that? There, right? Yeah. Just like what's in the book. Oh, and then we have the inner ear. Isn't that cool? All right, that looks something like that. Just right out of your book. Okay. Then we have the planes. Remember the planes? IOML, all that stuff. I don't even need to show you that. That's so simple, it's ridiculous.
I want to see.
It's the guy in the book. Another one of the guy in the book. Top of the ear attachment, stuff like that. Inner canthus, outer canthus. And then the guy in the book. Okay. The guy in the book. Yeah. All right, then it comes to the questions. So the first part is the questions. So you should know which bones make up the floor of the cranium. You should know how many bones make up the facial region. You should know what the bony landmark. Hey, Janice. You should know which bony landmark represents the highest level of facial bone mass. That'll probably be the toughest one on your test. You should know where the widest portion of the cranium is. You should know the name of the joint found between the lateral condylar processes of the skull and superior articular process of C1. You should know which cranial bone articulates with all the other cranial bones. You should know the ridge of bone just inferior to the eyebrow. You should know which of the following cranial bones articulates with the parietal bone. You should know what the fontanelles. The left fontanelle becomes the what in an adult. You should know how many fontanelles there are. You should know the fontanelles and what they articulate with the cranial bones. I'm sorry, not the fontanelle, the frontal bone. You should know what the frontal bone articulates with the cranial bones. You should know which of the following landmarks corresponds with the level of the petrous ridges. You should know what the pituitary gland is associated with and protected by what bone. In other words, where do you find it? You should know what cranial bone contains the foramen ovale. You should know which cranial bone contains the cribriform plate. You You should know what the following sutures separates the parietal from the occipital bone. You should know what the following terms are going to be to describe the anterior fontanelle in the adult skull. You should know the terms that we describe small irregular bones found in the sutures. You should know what the ethmoid notch, which part of the cranial bone the ethmoid notch is. And you should know which of the fontanelles is the last to close at about 18 months of age. All right. Any questions so far? Just kind of like rolling right through it. Sounds pretty simple to me. It's like giving you all the answers. Nobody ever flunks in my class. All you got to do is study. All right. You should know what the skull shapes are. 47 degrees, all that. You should know. In other words, the mesocephalic, brachiocephalic. You guys know that one. You should know the small flap of cartilage covering the ear. You should know what the difference in degrees between the infraorbital and orbital is. That's so simple, isn't it? What is it?
7.
There you go. Wow. Let's see. You should know. And I really preach this one too. You should know You should know what factor is most critical for demonstrating air fluid levels within a cranium. You got it. We want to do that upright, don't we? Okay, horizontal beam. Let's see here. In the knees. A radiograph of an AP axial projection of the cranium reveals that the dorsum sellae is projected below the foramen magnum, but the anterior arch of C1 is visible within the foramen. Which of the following positioning errors led to this radiographic outcome? So you should know that. I read it right straight from the test too, so look it up. You should know which of the following projections visualizes the anterior clinoid processes, and you know what that is. Okay. Everybody I've tested, I've always asked you that one there. And remember, for the sella turcica, it's always the IOML that we're going off of. So it's the degrees off of the IOML. A radiograph of a PA axial projection, a Caldwell, of the cranium reveals that the preputius ridges are located at the level of the 1/3 of the orbits. The technologists performed this projection with the CR angled at 15 degrees. How must this be positioned to be altered if a repeat exposure is performed? Okay, and what they're asking is was there anything wrong with that? Or, do we need, or not? Okay. A radiograph of a submental vertex, SMV projection of the cranium reveals that the mandibular condyles are projected into the petrous pyramids. You understand what that looks like, okay? What must be altered during the repeat exposure to get a better diagnostic radiograph? Next one, a radiograph of a lateral projection of the cranium reveals that the orbital plates are not superimposed. One is slightly superior to the other. Okay, remember what that is. Okay. Hear that? Okay, I guess that was before your time. Night at the Roxbury. No, nobody wants that.
Yes.
Okay, yeah, it's like, man. All right, so. Yeah, you should know which of the following errors led to that radiographic outcome. A radiograph of a lateral cranium reveals that the mentum was cut off from the bottom of the radiograph. 10 by 12 image receptor was used and it was placed crosswise. What must be altered if a repeat exposure is performed? All right. Then it goes on. You should know what the lesions of decreased density are termed. Okay, we actually have a term for that, lesions of decreased density. And you should know what both CT and MRI images can provide in terms of axial, sagittal, and coronal. You should know the PA axial projection or the Haas method or the reverse Towns. You should know the central ray angle for that. I didn't test you on that, but I did tell you what the angle was. Remember I told you all about that? We're going a certain amount for the AP Towns. Well, what do we do for a PA Haas, which is a reverse Towns? Okay, everybody remember that? Okay, good. Let's see here. What else we got? Where did I leave off here? Okay, next one. Situation. Oh my gosh, we have a situation. The patient came into radiology for a routine study of the cranium. He is unable to flex his neck, okay, head and neck, sufficiently to put the OML perpendicular to the IR for the AP axial projection, all right, which nobody really can anyway. So what should the technologist do to compensate for this problem without creating excessive magnification of the skull? Instead of using the IOML, we would use the, there we go. That's what I say. Instead of using OML, we would use the, there we go. I don't think I said that right the first time, sorry. Situation, patient enters the ED with a possible basilar skull fracture. Ooh. Which of the following skull projections would best demonstrate any blood present in the sphenoid sinus? You guys know what that one is? Okay, we're looking for a blood. God, I gave it away. We're looking for a fluid level. Okay, there you go. Situation: patient comes into radiology with a history of a possible erosion of the foramen rotundum. Ooh, that's not good. Which of the following projections would best demonstrate this structure? Situation: a patient comes into radiology with a possible bone cyst within the squamous portion of the frontal bone. Which of the following projections would best demonstrate that region? Situation: patient comes into radiology for a study of the sella turcica. Which of the following routines would best demonstrate this structure? And it's very simple, people. It's the two projections that you did. And you should know what the SMV projection is required in terms of like positioning. You should just know what the positioning is for an SMV, okay? Well, this has got to be this way, and you line something up, parallel to the image receptor. Yeah, it's just that simple. Oh, easy one. Which of the following projections results in the highest thyroid dose?
SMV?
That's the biggest whack of the bunch, man. Yeah, of all of them. Which division of the temporal bone contains the organs of hearing and equilibrium? Something about it. It's not a teepee. Find them in Egypt. Yeah, there you go. Which of the following structures is part of, you should know what the following structures of the middle ear are. Let's see, you should know what aspect of the ear has the eustachian tube. You should know what the additus, you should know what the additus is. You should know what the structures of the inner ear are responsible for hearing. Remember our hearing? And you should know what the osseous labyrinth has in it. You should know what the osseous labyrinth has in it. You should know where you find the sensory apparatus of both equilibrium and hearing. Okay, you should know about that. Almost done, people. You should know where the vestibule is located. Another situation, patient comes into radiology with a clinical history of acoustic neuroma. Which of the following imaging modalities would provide the best assessment for this? All right, now we're talking about different modalities there. So when you go into your book, you're going to see all kinds of little different areas. If this comes up, if this pathology comes up, what's the Cadillac, modality for that? Okay, if this comes up, what's the Cadillac modality for that? Okay, and we're going to be asking you on that with like Paget's disease, all right? Craniosynostosis, hydrocephalus, early detection of metastases, brain blood clots, intracranial hemorrhage in premature infants. And you should know which modality is most sensitive for detecting differences between normal and abnormal tissues. So that would, I think that's it for the, that's it for the modalities. So then we have a situation. Patient comes into radiology with, actually it wasn't, I'm sorry, here's one more. Patient comes into radiology with severe mastoiditis. Ooh. Which of the following imaging modalities would best demonstrate possible bony destruction within the mastoid? Mastoids are these little things back here, right back there. You can feel it right there. We used to do x-rays on those, all right? Plain film x-rays. Now we just send them to somewhere, Where do we send those people to? Yeah, it's very simple, very simple. Let's see here. So a patient comes in with a clinical history of a possible pituitary adenoma. Ooh, that's not good. Because this is a rural hospital, CT and MRI are not available. That really sucks. Which radiographic projection or position would best demonstrate signs of erosion of the cella turcica due to the tumor? And just think about it. If we're looking at the cella turcica, there's two views. Which would show it best? Okay, that's all you have to know. And that, people, is it. Any questions?